Mild is known as minimally invasive lumbar decompression. It's a very minimally invasive procedure that we do in the surgery center or the hospital. It's performed through a small incision that is smaller than a baby aspirin. Through that small incision, we're actually able to take a working cannula and get down to the part of the bone that's actually causing narrowing of the spine. Through that working cannula, which is almost like a little needle or tube, we take a tissue sculptor, which we can go out and take bone spurs and ligaments that are pinching on the nerves. This procedure usually takes anywhere from 15 to 20 minutes. Patients will go home, take it easy and rest for that day, but the next day they have no restrictions. Most patients will notice relief of their stenosis symptoms, usually within 24 to 48 hours, and over the first 6 weeks they'll continue to get improvements. This is usually a great long-term therapy for patients who don't want to go through a large surgery. Vertiflex is a minimally invasive lumbar decompression device. So for patients who have a little bit more advanced stenosis or moderate stenosis, this is a long-term fix for their stenosis symptoms. This is an actual Vertiflex implant. It's a titanium implant that actually gets implanted between the spinous processes of the level where they have the narrowing. So for example, if we look at someone's spine, when they go to stand, the nerves start to get pinched. If we go at the affected level and implant this small implant through a small half-inch incision, now when the patient goes to stand and walk, that nerve no longer gets pinched. The way the procedure is done is it's usually done in a surgery center or hospital. It takes about 15 to 20 minutes. We use a small half-inch incision, and through a series of dilators are able to put this implant between these two spinous processes. Patients will have some restrictions where for the first week or two we'll try to limit their bending, lifting, and twisting. Try not to lift more than 20 pounds. Usually by the 4th week we start to lift off restrictions. The great thing about Vertiflex is what the long-term benefits and outcomes are. When we look at the studies at 8 years, patients are still having over 80% relief of their stenosis symptoms, and they have an over 90% satisfaction rate.